extent do you see that regulation can be a barrier to good user experience? Because in some instances, when you work on healthcare IT, you can understand, that the user is going to want as little clicks as possible in the software that they're using, but in practice, they might have to log in each time they have a new patient, or just get some authorization processes through before they finish what they're doing, or use clinical decision support systems that they use mostly for ignoring all the warnings, but that still kind of messes with their workflow. And that decision support system, even though it's not really doing much, has to be there because that's the requirement.
Yeah. Again, so there's a very good study where nurses in all sorts of environments, and this was a US study, and asked them, were you part of the implementation or design of the electronic medical record system that you're using? And 99% of them said no. And so this is the epitome of doing healthcare in which it's simply for viability and feasibility, getting back to those original concepts without taking into account the desirability part. And as you said, this is the great example of nurses hacking the system, where they figure out ways to get around those warnings on the EMRs. They figure out ways to pull medicines more quickly without registering it on the EMR and then later registering it on the EMR because it's just in their way. The way you build these systems is to start with understanding what the users actually need and moving back from there. The regulations part that you're talking about are real, and you need to stay within those as well. But if you start with the regulations, you'll never make a great experience. If you start with what the experience can be, then you can figure out how to weave the regulations in. A large part of that has to do with just simply the one recommendation for anyone who's making any clinical tools like that is just pre-populating forms as much as possible. Being able to have information be pulled from one part, not only integration with other systems, but integration with your own system. If information was already filled in about a patient, you can pre-populate the next form and put in ways that the provider can acknowledge or confirm that information in there rather than having to type it in themselves. That's the lowest hanging fruit I could possibly talk about. If you're not starting there, you're not understanding what a provider needs.
The different hospitals and different countries have different ways of working. So when you're trying to implement an IT system in different institutions, you can very quickly realize that the desires are very different because the clinical guidelines can differ to a certain extent and the habits that the users have are different. So to which extent do you see that as a problem? How do you address that issue to create scalable solutions?
Yeah, modularity is a very important design concept when creating these clinical tools. So the ability to have a scalable system that maybe addresses 80, 90% of the use cases, and then within that, having the ability for the user to be able to modularize and change what their user interface looks like. That's going an extra mile to be able to actually make user experiences really work. After you do that, or while you're doing that, and you have to have also a way of electronically watching what users do on the platform, because you're allowing them to hack the platform. You're allowing them to say, this module, this part about this patient's history, I'm never using, so I'm deleting it off of my view. And then on the background, running data analytics that, one user did that, 10 users did that, 100 users did that. And then you create a very tight user product feedback loop to say, okay, that rises to the level of importance for feature creation. And so now I know that this is something that a lot of users are trying to hack around. I need to create a better system for them. This is what I mean by not only is saying that the best designers are the users themselves. They might not ever tell you what they're doing to your system, but if you create a system that allows them to hack and you are observing it, you can make a better system on the next iteration, the next version of your software.